are still discussing medication adherence, and we're looking at the clinical outcomes as a result of non-adherence or non-compliance to medication, and economic outcomes. In clinical outcomes, as discussed earlier on, we're looking at the individual who has not adhered to his medication properly as recommended by the physician or the pharmacist, is likely going to have increase, is going to have though you have relief of symptoms immediately, when you a bit later on, you are going to still have the condition is still there because you've not actually completed your dose or something. Then economic outcome. In an economic outcome, we are looking at the person's the cost of therapy. The cost of therapy will be higher. For example, you spent 2,000 to get a drug and you not complete it. The disease condition is still there, and you still have to spend it again when you have those symptoms come up again. So generally, we've been able to discuss medication adherence. So like I mentioned before, let me just quickly do a recap. Medication adherence is the degree at which person's behavior corresponds to the recommended procedure, or recommended dose of how to take drugs as prescribed by the physician or the pharmacist. And we took time to discuss the possible causes why people don't take their meds or comply to meds. We've talked about multi-meds. We've talked about multi-meds. We've talked about what else? We've talked about multi-meds. We've discussed multi-conditions. We've discussed route of administration. We've discussed cost of therapy. When the cost of therapy is high, we've discussed about other external factors. And please, it is better, like I said when I started the video, I said the most important aspect when you're starting a drug, when you're starting a treatment, is medication adherence. This should be your most important, like what you should do, like, because when you're not taking your drug and when you're not adhering to your drug or complying to your drugs, there is no how the disease condition will go, or there's no how you have relief of symptoms. So thank you very much for being for watching this edition of Let's Learn Together and medication adherence. Thank you very much, and please click on the subscribe button after you watch the video. Thank you.